Hello everyone. Today we will consider the topic of how to determine pregnancy. The most reliable signs of pregnancy. Topic include the following questions. The first question is why earlier pregnancy diagnosis is necessary. The second question is when does pregnancy make itself felt? The third question, the most reliable signs of pregnancy is the lack of regular menstruation. Positive pregnancy test. The presence of chorionic gonadotropin. Examination by a gynecologist on an uterine ultrasound chair. So let's consider the first question: why is early diagnosis of pregnancy necessary? Pregnancy is an important moment for every woman, and let the news about that a small life is already developing inside, it gives someone true happiness, and someone causes panic and fear. You always want to know about it as soon as possible, and so early diagnosis will help. First, decide. If it is planned to maintain pregnancy, it is very important to pass all tests on time and calculate the possible risks of fetal pathology in the early stages of a woman's choice to continue bearing or stop the second. Do not harm in the early stages of pregnancy. The embryo is extremely vulnerable. Often expectant mothers take potent drugs, continue to be smoked only because they don't know that a new life has already begun, and a third one should not be delayed if pregnancy is undesirable. You need to do at the earliest possible period of up to 6 weeks. During this period you can do without surgical. The gynecologist will recommend interventions. Medical abortion. Abortion pills, or if there are contraindications, vacuum abortion. So when does pregnancy come to light? Referring to I want to note to science that the first week after conception cannot yet be called pregnancy. The fact is that a fertilized egg moves to a place within 70 days, where it will be located and develop from fetal embryos. Only after its attachment to the walls of the uterus can we talk about the onset of pregnancy. Menstruation come if this attachment did not happen, and then the woman does not even suspect that there was a conception. If the fertilized egg reached the uterus, then implantation occurs in the uterine wall. Embryo implantation. After successful implantation, the umbilical cord begins to form and the placenta. The first week after conception is very important in the period of conception of a new life, since the body women perceives the embryo as a foreign body in every possible way, tries to tear away, not allowing it to gain a foothold. After successful implantation of the embryo, first of all, hormonal changes occur in the woman's body, due to which the first signs of pregnancy are manifested. So consider the most reliable signs of determining pregnancy. The first sign of the absence of regular menstruation, which for many women is the most significant sign of pregnancy. But you need to keep in mind that several days of delay cannot yet reliably talk about the onset of pregnancy, since the cycle can go astray for various reasons, for example, nervous experiences of the disease, and also sometimes is an exception in pregnant women in the early stages, bleeding, the cause of which may be hormonal disorders. Implantation of the fetal egg. Pregnancy right before menstruation or fertilization. One of 2 egg cells. The second sign is a positive pregnancy test made at least 3 times by a break of several days. The highly sensitive diagnostic test starts the minke whale for the first day of the delay, but it is better to wait about 7 days when it will be more reliable. But I want to note something. A will be positive in ectopic or missed pregnancy, as well as the first time after a miscarriage. The third way to determine pregnancy: examination by a gynecologist on an armchair for a period of 6 weeks. The cervix becomes softer and acquires a bluish tint due to blood circulation is marked, and the isthmus between the body and the uterus. An enlarged uterus is detected. The fourth sign of pregnancy is the presence of chorionic gonadotropin (hCG), detectable in blood and urine. Woman. This is a hormone that begins to be produced by the Hari tissue, and after implantation of the embryo, as early as 6–8 days after fertilization. Ovum is one of the most important indicators of the presence and well-being of pregnancy. It is designed to maintain activity of the corpus luteum. Producing progesterone are necessary to maintain pregnancy. And the fifth way to determine early pregnancy: ultrasound of the uterus, which detects implanted and tighten egg. Ultrasound testing should not be performed before the onset of the 5th week from the beginning of the menstrual cycle before the embryo develops incomprehensibly or not, and with such a short time, the embryo will be visible only during diagnosis by inserting a sensor into the vagina. If this study was conducted early, then the interesting position of a woman can still be assumed for the presence of a corpus luteum up to 25 mm in size. These were the 5 most reliable ways to determine pregnancy.